But has there been any patient who has walked in with symptoms and you've not been able to diagnose it?
So there's this very interesting condition um, called somatization disorder. And somatization is when you convert a psychological symptom of anxiety or distress into a physical symptom. And how Freud described it was, he said the anxiety of the conflict in your mind is so high that you can't even begin to kind of process it or acknowledge it, and therefore you sublimate it into a physical symptom, right? Um, the in this type of problem, a person has multiple physical symptoms but without actual physical cause, and they end up seeing different specialists. So atypical facial pain is something that people go to a dentist to, or a neurologist or an ENT surgeon, and then they hear there's nothing wrong with you after various tests. Okay. In the same way, people who panic and have anxiety attacks and have palpitations often end up with chest pain or often go to the cardiologist.
Right.
That's called atypical chest pain. Okay. There are people, both irritable bowels and constipation are often related to the emotional state of the individual. There is fibromyalgia, which some people believe is a condition on its own. Many people believe it is a type of somatization, a psychosomatic condition. So like this, we have several examples of conditions that befall us. And we had a lady who was actually the wife of a doctor, who for 2 years would feel hungry half an hour after the last meal, and then would end up eating another meal. And of course, she gained a lot of weight. Of course, she was pretty dysfunctional. Of course, she had to go to the loo several times a day. And she wasn't having a normal life at all. And her husband, being a doctor, she had had the best of diagnosis done. She'd been to various specialists, various tests had been carried out, and everything was negative. I wrote about this in the Hindu magazine called What's Up Doc. And basically, what it was that she had this psychosomatic condition where there was emotional stress, not very well acknowledged, not very well worked with. There were these autonomic symptoms because chronic stress had switched on the autonomic nervous system and caused what we call dysautonomia. And there were, as a consequence of that, a whole host of physical symptoms which she was struggling with. And finally, what got her better, very interestingly, was integrative health. What got her better was, one of the treatments we use is called mud packs, where we use river mud and create a pack over the abdomen, and that settled the bowels for her. She stopped having these crazy hunger pangs that made her eat more and more and more. And so like that, yes, we do come across people who be fatalasa. But very interestingly also, there's a word of caution here that we need to be aware of. There's a very famous psychiatrist at the National Hospital, Queen Square, which is the mecca of neurology, where I trained in the old days. And he did a study where he showed that when neurologists diagnosed people as having hysteria, he took out 100 such case sheets and followed up those people to find out what happened. A very large proportion presented with a real physical cause later. So in a sense, one should never be in a hurry to label something as it's all in the mind, and one needs to try and understand the person as a whole. And to be quite fair, I think people who go through something like this are suffering. They also don't know what's wrong with them.
That's
And
right.
I don't think anyone wants to suffer.
Right.
So it's really a question of us helping them accept their problems a little better, work through their problems, and get symptom relief over a period of time. And psychological therapy can be very helpful in that. Something like TAVNS can be very helpful in that. And of course, as I mentioned, the holistic therapies can be very helpful in that. So there is hope for people with these unexplained symptoms.
Right. It's also a lesson to treat the body as a whole, right, and not as parts.
Absolutely, absolutely, because I think we live in so much of a specialist era that one famous physician commented that you'll soon need somebody to count the fingers. And so yes, from that perspective, that holistic view of an individual, body, mind, and soul as one is very, very helpful.